discuss on some more common poisons which are important for you on. त्यसमा चाहिँ we'll start with opioid poisoning, त्यसपछि mushroom poisoning र spinal poison. पहिला spinal poison गरौँ, mushroom poison र opioid भनेको somniferous type of poison. Okay, so spinal poisonहरू के हुन्छ? Can anyone name? What are the spinal poisons?
Strychnine.
Okay, strychnine. Okay, strychnine next nux vomica is one of the commonly common poison that causes spinal poison. All right, and it is one of the very powerful this alkaloid हो. अब poison itself यो strychnine को कुन part poison छ? This is the plant of nux vomica, strychnine nux vomica भन्दाखेरि अरु partsहरु poisonous हुने हैन. The most poisonous part is the seed हैन. Seed appears like this. All right, and seed, when it is crushed, it becomes poisonous. Crushed, and if it is ingested, then it is poisonous. And the most important active principle of strychnine is strychnine and leucine. All right, and how it acts on that, it acts on the ventral horn motor neuron, postganglionic receptor site in the spinal cord, and prevents the effect of glycine. So that is how it acts. Our IO's signs and symptoms. Okay, signs and symptoms, they develop in 5 to 15 minutes. All right, and it has bitter, uneasy, restlessness, suffocation, and fear, increased acuity of perception. So all the perceptions are increased. And perception के बात हुन्छ? There's vision, feeling, sound, हैन सबै perceptionsहरु चाहिँ increase हुन्छ. Muscular rigidity and twitching, and finally there is convulsions. Okay, direct action on the reflex centers of spinal cord. So since it acts on the spinal cord, it causes convulsions, affects all the muscle at the same time. Okay, convulsions is सुरुमा clonic हुन्छ, then tonic, and it repeats. This whole episode is within half to 2 minutes, and face becomes sinuosed and has an anxious look. Have you heard this term Rhizus sargenicus? कसैलाई थाहा छ Rhizus sargenicus भनेको के हो? And if you know, please explain what is Rhizus sargenicus. थाहा छ भने भन नभए I can go on. Yes or no?
No, ma'am.
No, ma'am.
Okay, Rhizus sargenicus भनेको तिमीहरूलाई टिटानस हुँदाखेरि के सिम्पटम्स हुन्छ थाहा छ है? टिटानसमा के सिम्पटम्स हुन्छ? त्यसमा
muscle rigidity हुन्छ म्याम.
rigidity हुन्छ हैन? अनि Rhizus sargenicus भनेको चाहिँ facial muscles contraction or rigidity हुने हो. त्यसले गर्दाखेरि a person appears like a smiling face को appearance दिन्छ के पक्कै. If I can show you a picture, wait. Okay, it appears like this. Smiling face or facial muscles are rigid only. Okay, that is Sargenicus. देखियो पिक्चर देखियो
छैन म्याम
देखिन होला सरी एकछिन अहिले
देख्यो
can
म्याम
you देखियो है this is how it appears. Okay, and next is hyperextension, where again there can be various ways of extension. If it is from the behind, then dhanush बाण जस्तो हुने जुन टिटेनसमा हुन्छ त्यस्तै it is known as ophitotonus, and if it is from the front, then that is known as emprosthotonus. If it is from the sideways, laterally, either sides boy one say furostotonus. This is how it appears. And in between the convulsions, muscles are relaxed. If there are around 4 to 5 convulsions, then that death can occur. And diaphragm and thoracic muscles causes of death is due to contraction of diaphragm and thoracic muscle. When patient cannot breathe, that causes medullary paralysis due to hypoxia. So that is the cause of death. अब मैले अघि राम्ररी पिक्चर देखाइन जस्तो लाग्यो. This is how it appears, है. Spinal this strychnine nox vomica. Now this is available in our museum, so please look carefully. This seeds, duita seeds also, so it's easy to recognize, and I'm sure you can write down the signs and symptoms as well. अब सोध्ने नै त्यो mechanism of action के हो, active principles के हो, signs and symptoms के हो र what can be the cause, medical legal aspect, and post-mortem findings. Okay, so this is ophithodonus. The fatal dose is around 50 to 100 mg, or one crushed seed is enough to cause fatal, to be fatal. Fatal period is around 1 to 2 hours. Treatment, if a person should be kept in dark and noiseless room. Why? Why is it so? Nobody is answering. Why should a patient be kept in dark? As के भयो सबैजना सुत्यो कि क्या केही त रिजन होला should be kept in dark and noiseless room भनेछ
इन्क्रिज एक्युटी अफ पर्सेप्सन भनेको छ नि म्याम त्यसले गर्दा
पर्सेप्सन हो यो क्लासमा एकजना दिपेन्द्र मात्रै छ के अरु कोही छैन अब त मलाई उसको मात्र भोइस उसको भोइस मात्र चिन्ने भइसक्यो मैले okay so since perception is increased to treat a person, to make the person calm. He or she is placed in dark, noiseless room. अब यसको particular antidote हुँदैन खाली हामीले अरु supportive care र स्टिमुलसलाई मिनिमाइज गर्ने मात्रै हो अरु एक्सटर्नल स्टिमुलसलाई मिनिमाइज गर्ने मात्रै काम छ हाम्रो त्यसैले we can control convulsions by giving diazepam, short acting barbiturates, stomach wash to remove the unabsorbed poison by potassium permanganate, acidification of urine due to increased strychnine excretion ko लागि चाहिँ acidification of urine can be done, and other symptomatic treatments. Post-mortem appearance, again non-characteristic. Rigor mortis appears early. Signs of asphyxia may be present. Rigor mortis किन early हुन्छ? अब except Dipen, right? If anyone can answer.
Muscle contraction.
Muscle contraction. Thank God someone else answered. Ko थियो? Who was it?
Ma'am, Aman Guru.
Aman. Okay, thanks, Aman. As there is convulsions, surumai convulsions. Before that, antemortem, antemortem condition, if there is muscle contraction or convulsions, then two particular muscles, ma chito rigor mortis huncha. All right. So my rigor mortis appears early. Signs of asphyxia, kina huncha, because respiration is affected, as there is uh, contraction of muscles of diaphragm. There is asphyxia, the currently got the signs of asphyxia is there. On muscle contraction boy pitch, there is extravasation of blood in the muscles, so that can be found. Viscera are congested. Okay, our orco easy method of diagnosis is they can be detected in blood, urine, gastric fluid, bile, fixed liver and kidney samples should be sent. So strychnine is seen. अब strychnine poison कस्तो type of poison हो medical legally homicidal कि suicidal कि accidental कुन poison
Accidental.
okay mostly accidental. It can be used as homicidal poison or not. मैले
सकिन्छ होला
भनिहालेँ
म्याम, त्यो अब रेस्पिरेटरी
किन
कसैले प्यारालाइसिस गरेर मार्न खोज्या हो कि त्यस्तो नि सक्नु।
okay do you think it is an ideal homicidal poison Dipendra अब तिमी नै मात्र छौ यो क्लासमा त्यसैले I'm asking you.
म्याम क्वेसन म्याम
Can this be used as an ideal homicidal poison? Can it be an ideal homicidal poison? Yes or no?
यस म्याम इट क्यान बी।
Uh, any any reason behind it if it's used as ideal homicidal? Dipendra answer नगर्ने अरु कोही answer गर्ने भने पनि I'm okay with that.
Tetanus जस्तो like
Tetanus
naturally
appearance, when you see the signs and symptoms, it resembles a natural disease. Okay, so it can be used as an ideal homicidal poison. तर अब यसको disadvantage पनि छ किनभने this can be easily found, detected in blood, urine, or even in decomposed body मा पनि easily देखिन्छ. But again, due to its resemblance to natural disease, it can be used as ideal homicidal poison. But yes, you are right, accidental poisoning धेरै हुन्छ हैन. अनि त्यो बाहेक अब सेल्फ हार्म गर्न पनि गर्छ मान्छेहरूले, but since it's very painful, suicide is rare. But now again one question arises, that is if it is tetanus okay strychnine poisoning, how can we determine that there are differences given? So another important question is here. Okay, so strychnine र tetanus को difference के हो भन्दा history of injury हुन्छ tetanus मा जहिले पनि, strychnine मा no history of injury, onset sudden हुन्छ, यसमा gradual हुन्छ हैन. Convulsions, all muscles of the body are affected at the same time. अघि हामीले signs and symptoms मा भनेको यसमा चाहिँ not so particularly हुँदैन कुन कहिले कुन part of muscle हुन्छ कहिले कुन part. Lower jaw not affected or usually starts in and is affected. Muscle condition relaxed between the fits हैन. दुईटा एपिसोडको बिचको कन्डिसनमा चाहिँ muscles conditions are relaxed, whereas it is rigid in between the fits. Fetal period is within 1 to 2 hours, whereas tetanus को 24 hours. Chemical analysis मा strychnine is found, no poison found. इसको सट्टामा history of injury is there. Okay, this difference is important, so please go through this. All right, actually, let's sign in back again after 5 minutes. 5 minutes, and we'll continue.